Oxford Physical Therapy Facebook followers. My name is Matt Ernst. I'm joining you today from headquarters, our Oxford corporate location here, Command Central. And I'm joined by Rosie. Rosie's a nursing student who also works as our marketing admin here at corporate. And what we're talking about today is backpack safety. We're going to kind of go over some tips and tricks of how to fit the backpack properly. Back to school last week for a lot of kids, so they're a week into it. You might be starting to hear your kids or yourself maybe complaining of some soreness or some aches and pains. And we're going to give you some tips and tricks of how to maybe minimize those and what to do if they're not going away or getting better. So what we have here is kind of your basic standard backpack. This is about normal size, loaded probably about like most middle schoolers or high schoolers would. There's actually still some room to put into this backpack. And this backpack's upwards of about 20 pounds or so. So when we talk about backpack weight, what we want to do is look at about 10% of body weight for middle schoolers and high schoolers, and about 5% of body weight for grade schoolers. So, most people, that's going to put them in the 10 to 20 pound range, and for anyone, we wouldn't recommend going more than 25 pounds. So we're going to have Rosie put this backpack on here, and we'll just kind of take a look specifically kind of how it's fitting her. You'll notice this backpack has two pretty wide straps, which is great. Even more helpful might be a chest strap across here to kind of hold the two together if you were going to be going for a long distance, if you had to go long to the bus stop or between classes or something. If I have Rosie turn around a little bit to the side, what you can see is this backpack's kind of pulling her and causing her posture to lean a little bit. So this backpack's a little bit lower than what we would like. If you kind of draw a line between the shoulder blades, so if we look here between the shoulder blades and we look about at the belly button, we shouldn't be any more than 4 inches below. So this backpack's actually hanging a little bit lower on Rosie, and what you can see is that makes her kind of have to put her head out forward and kind of round her shoulders to compensate. So it wouldn't be long before walking around with this kind of thing would start to hurt, wouldn't it?
Yeah, it's already starting to hurt.
So what I'm going to do is lift up a little bit. If you can take these straps and just cinch them down a little bit, we want the backpack to rest somewhat right about here. Tighten those up a little bit. I'll give you a hand.
Okay. Yeah, she's got that in there really well.
There we are. And this one's a little twisted. Bit more here. And this is what I would kind of do with your kids at home, is tighten it up first and see how that fits. So that's up a little bit higher for Rosie, a little bit better. It's still creating her to be a little bit back leaning. So if Rosie had to carry this for a large amount of time, I'd probably have her take the 1 or 2 heaviest books out and carry them in front. And these are some of the specific tips and tricks and tools that we're willing to do at all 20 of our locations this month. If you bring your child or you want to stop by yourself with your backpack, we're doing free backpack fittings and screenings, and we can help you individually correctly get in the right position. The other thing that we really want to let our communities know is, as we've seen more and more patients of younger and younger age, we want to let you know that physical therapy allows direct access. So in both Ohio and Kentucky, you can come straight in for care. And we're learning through a lot of different research and a lot of different avenues, the earlier we get access to anyone with back pain or issues, the more impact we can have and the less symptoms they have along the road. So direct access, you can come straight into physical therapy without a prescription or a referral. We can give you information, treat you for your issue, and this month we're doing the free backpack fittings and screenings. Does any followers out there have any questions that they want to maybe submit? We could certainly answer them. All right. I hope you guys have a great week, a great Monday. I hope it's a safe back-to-school season, and if not, please feel free to stop by any one of our offices for a free fitting or screening. Remember, our website has all the locations, and you can even schedule your appointment there, too, if you just go to oxfordphysicaltherapy.com. Thanks.